Well, thank you very much. I think it is important to remind ourselves that the whole MDG discussion, remember MDGs? The whole MDG discussion started with one single objective, which was the eradication of poverty and hunger, right? So SDG 1 and 2 are precisely about that, no poverty and no hunger. And I think it was important for us to remind ourselves of that. Particularly for those who are less familiar with nutrition. SDG 2 focuses primarily for us on 3 issues, which is the elimination of hunger, that means no famine, no starvation, achieving food security for all, that means food available for everyone in the household throughout the year, and improving nutrition. And I would say that this improvement of nutrition has a particular emphasis on improving the nutrition of children and women. More specifically, SDG 2 aims at achieving 6 nutrition targets. Those were the nutrition targets endorsed by all the state members of the World Health Assembly for 2025. And we're going to review them now to stretch them all the way to 2030. These global nutrition targets include a number of ambitious objectives, ambitious targets, but let's say for the purpose of this presentation, 3 major targets to reduce stunting, wasting, and underweight. So 2016, how did we start the year? This was year 1 of the SDG era. We started the year with 156 million children stunted, that is affected by chronic malnutrition, 50 million children wasted, that is affected by acute malnutrition, and 42 million children overweight or obese. Therefore, we could say and summarize that the beginning of the SDG era from a nutrition point of view is characterized by 2 things. One is very high but declining levels of child stunting, and lower but increasing levels of child overweight and obesity. UNICEF is trying to respond to these multiple nutrition challenges in children and women through our current strategic plan, the nutrition program, that includes 5 program areas: improvements in infant and young child feeding, that is breastfeeding, complementary feeding, micronutrient supplementation, and food fortification when diets are not rich enough to provide all the nutrients that children need. If prevention fails, care for children with severe acute malnutrition, both in non-emergency and in emergency settings. Improving the enabling environment for nutrition, that is policies, programs, partnerships, and guidance. And of course, all of the above also in emergencies, not only in development settings, but also in emergencies. Now we're going to share with you a few of the highlights of our program in 2016, and so that you don't only hear from me, I'm going to hand it over to 2 of my colleagues. So Franz is going to present some of the highlights on breastfeeding, complementary feeding, micronutrients for children, and food fortification. Diane will present some of the highlights on the provision of care for children with severe acute malnutrition, emergency response, and also our work in partnerships and a convener for nutrition. And then I will take it back and speak to you about the progress so far, the resources that are needed for the future, and the intention of our work plan in 2017. So over to Franz.
Thank you, Victor. So because breastfeeding promotion and support is so key to, for child survival, to reduce child mortality, morbidity, improve development, and also improve maternal health, it's really important to make sure that we have support in communities. And the data here are encouraging in the sense that we have 90% of the countries that had the capacity to provide breastfeeding counseling support at the community level. Of course, it doesn't say anything about the quality, but we have the structure to be able to provide that support here. Having also the legislation in place, the International Code of Marketing of Breast Milk Substitute is absolutely key also to protect breastfeeding. In that regard, we had good progress with now 70% of the countries that have some form of legal measures on the code. And it's quite good progress if we compare with 103 countries that we had a few years ago. The World Health Assembly has a global target of reaching children, under 6 months children with exclusive breastfeeding and aiming that we have 50% of children exclusive breastfed globally. In that regard, we have now a third of the low middle income countries that have at least 50% of the children under 6 months that are exclusive breastfed. So good progress, but also still some more to achieve before 2025, and it's only a minimum here, I should say. We know also that one of the key interventions to reduce stunting is making sure that the diet of the children is adequate in terms of quantity and quality. So we were very pleased last year when UNICEF, we published our first ever report to give a situation on the quality of complementary food in countries where we had the data. And really the results are quite striking and also shocking. We have about 1 out of 4 children 6 to 23 months that had a diet that meets the minimum in terms of the minimum number of food groups, like at least 4 food groups per day, so 1 out of 4. And then when we look at the number of meals per day and the quality of the food, only 1 out of 6 of the children meet that minimum. So there's no surprise that we have so much stunting globally when we see this kind of figure. And because, as I just mentioned, the quality of the children's diet is so poor, we do need also other interventions like the use of micronutrient supplementation and fortification to improve the children's health, nutrition, but also to improve the children's diet. So here we are, good progress to share on that front with 87% of the children who are aged 6 to 59 months have been receiving 2 doses of vitamin A last year. And in the priority countries for UNICEF, this means 273 million of children who have been receiving those 2 doses of vitamin A. Again, absolutely key for child survival. We also use micronutrient powders, which are sprinkled on the food of children to improve the quality of that diet. And last year, we had over 10 million of children who were reached with those micronutrient powders to improve the quality of their diet. And we make sure also that these micronutrients are distributed in the context of improvement of overall diet, so making sure that this is not distributed in a separate parallel, as a separate and independent intervention. Lastly, one important way also to improve micronutrient intake, it's through large-scale fortifications, so using food that is consumed by a large proportion of the population and making sure we had the vitamins and minerals so that it reach a large proportion of the population. And salt iodization is one of the best examples of large-scale fortification. As of now, we have only 20 countries that are iodine deficient compared to 110 in 1990, so really, really great progress. And we know also this is one of the best ways to prevent children's brain damage. It's really by ensuring that there's sufficient consumption of iodized salt. And again, last year, the results were quite encouraging, where more than 85% of the households are consuming iodized salt. So very, very good progress. And lastly, to make sure that we also address iron deficiency, anemia, and other micronutrient deficiencies, use of fortification of cereal flours that are consumed, again, by the majority of the population is another form. And as of last year, we had 86 countries that had mandatory legislations for fortifications of their cereals.
Thanks, Franz. So at the base foundation of the house that Victor put up, it was the underlying access to a variety of sectors. That is what we think is one of the clear comparative advantages of UNICEF, that we are able to work in-house with WASH, with health, with ECD to be able to bring together the multiplicity of efforts to prevent undernutrition. That's where we want to be able to say, and Franz highlighted a number of very nutrition-specific interventions to prevent malnutrition, but we very much acknowledge that when prevention fails, UNICEF has a critical role in working with national governments and capacity to ensure that children with severe acute malnutrition are identified and treated in a timely manner, that they are able to access life-saving care. UNICEF has done tremendous work, and I think moved the dial from making sure that 1 million children accessed treatment in 2009 to about 3.4 million children last year overall. We'd like to say that while severe acute malnutrition is oftentimes associated with emergencies, a far greater number of children are affected by severe acute malnutrition outside of emergencies. And yet, only 1 million children with severe acute malnutrition outside of emergencies were able to access life-saving care. This is in the context where we are able to integrate SAM treatment into health services, and we are also not faced with the same access issues that we do in conflict and humanitarian contexts. I think that it underscores very much the critical importance of effective community health platforms and collaboration across sectors. Next. When it comes to emergencies, we had more than half of our UNICEF country offices who had to respond in some way, shape, or form to a humanitarian context in the last year. And our approach to emergency response is led by our core commitments for children and humanitarian action, as well as our role as cluster lead agency for nutrition. That again highlights UNICEF's comparative advantage of being present before, during, and after an emergency response. I think that while we certainly have moved the dial of access to treatment for severe acute malnutrition in emergencies, which is often seen as a core primary life-saving activity, there is so much more that we need to do in other areas, including making sure that we're enabling access to infant and young child feeding, that we're working together across food security, water and sanitation, and health sectors to ensure that children and families receive a package of services to enable them to survive and thrive, and that the short-term consequences will not become aggravated and that we do not contribute to stunting and other forms of malnutrition through the humanitarian response, in particular in protracted emergencies. I think that one of the most critical ways that UNICEF can work together to realize the rights of children is through engaging in the enabling environment and ensuring that policies, capacities, and programs are risk-informed and are developed based on an understanding of risk and vulnerabilities and are able to embed national capacity to identify and treat and rapidly address any particular nutrition problems as they arise. Over 57 countries and 3 Indian states are part of the multi-sectoral governance structure that's promoted through the Scaling Up Nutrition movement. We have a majority of countries where UNICEF has worked to strengthen nutrition policies, and that UNICEF has leveraged a huge comparative advantage around knowledge generation in terms of identifying and documenting lessons learned and putting it out to shape not just how we do it, but what we do when we prevent and address malnutrition in all its forms, One of the critical areas that UNICEF is very privileged to inhabit is as a convener in the world of nutrition. This is either in terms of a primary convener or a participant in coordination committees or participant in executive boards, which enables UNICEF to steer the global agenda, engage across a wide range of disciplines, as well as contribute to the global knowledge base and develop technical guidance and updated resources to effectively prevent and treat malnutrition.
So the final segment of our presentation, which is about progress so far, the resources and the way forward. And I'm looking at Cecilia because anytime now she's going to show me that you have 2 minutes to go. So progress in 2016, 89%, almost 90% achievement, which we consider satisfactory, but 100% would have been better. So let's have a word about that. Strengths and challenges, multiple, but I selected a couple of strengths and a couple of challenges for us. In programs, our strength, and you probably noticed that with the presentation by both Franz and Diane, large-scale programs to protect, promote, and support breastfeeding, that is core to us and core to our work. Large-scale programs on micronutrient supplementation for children and large-scale food fortification. Challenge. The scale-up of nutrition programs for adolescent girls, women, and mothers was limited, and we're going to have a word about that. It remains a challenge for us, yet still an area of focus. Externally, our strength, obviously, UNICEF still recognized as a partner of choice for maternal and child nutrition by governments. That is the most important thing, but also by international partners and national partners. Our challenge, and we will have a word in the next 2 slides, low thematic funding limited our ability for comprehensive programs. So there are 3 facts about thematic funding for nutrition that I want to share with you this morning. The first one is that UNICEF in 2016 received $240 million in the form of other resources, that is, resources coming from our partners. Only 3.4 million of those $250, that is 1.4%, was thematic funding, that is, funds with the flexibility for us to cover those programming areas that otherwise are orphan areas, such as the ones I have mentioned before. And nutrition was the program in UNICEF with the lowest allocation of thematic funding. So those are 3 facts. And as everything in life, facts do have consequences. So as a consequence of this situation, we were limited or not able to scale up programs to improve child feeding in the first 2 years of life, despite the data that Franz was sharing with you about the suboptimal diets of children in the first 2 years of life. We're limited in our ability to scale up programs to care for children with severe acute malnutrition in non-emergency settings, despite the fact that the largest number of children with severe acute malnutrition live in non-emergency settings. And we were limited in our ability to scale up programs for adolescent girls, mothers, and women. So my final slide is about 2017 work plan, our highlights, and the resource needs. Obviously, taking into account the previous slide, our annual plan for 2017 stresses 3 key areas, those areas where we have not performed as well in the past: scale-up programs to improve feeding in the first 2 years of life, scale-up programs for children with severe acute malnutrition in non-emergency settings as part of routine services for children, and scale-up programs for adolescent girls, mothers, and women. Externally, we will continue to lead and support the Scaling Up Nutrition Movement and the Global Nutrition Cluster. Those are the 2 key platforms to bring ownership about nutrition results in countries, but we will also continue to support large-scale partnerships for nutrition. Funding-wise, I have given myself, and we have given ourselves the challenge, and we hope we will be able to meet it with your support, to multiply our thematic funding for nutrition by a factor of 10. That is, we need to move from 3.4 million to 34 million in the coming months or in the coming couple of years if we are to cover those areas, programming areas, that otherwise will remain orphan. I don't want to miss the opportunity to say thank you to those who have supported us, all of you, in the previous years. So the list would be long, so it's on the slide. Thank you very much, and we're open for any question or suggestion that you might have. Thank you.